Zinc supplementation for acute lower respiratory tract infection.
A reflection of key learning points from a randomized controlled trial in Thai children.
A presentation by Namrita Rai
and Subij Shatke. The interplay of nutrient supplementation and infectious disease is an interesting area of exploration for us. Our background research revealed that the role of zinc in infectious diseases is attributed to three main functions: the structural function, tissue regeneration, and the anti-inflammatory function. We chose this article as the use of a randomized controlled trial to correlate physiological functions can inform the basis for new pediatric recommendations. The methods of this study are described under four headings: the study design, the randomization and blinding, data collection, and the outcome variables with statistical analysis. The study we chose was a randomized, double-blinded, placebo-controlled trial which was conducted in MSMC University Hospital between June 2017 and January 2018. The study participants were children aged between 2 to 60 months admitted with clinically diagnosed ALRI. The inclusion criteria included tachypnea, one of the four ALRI signs or one of the four danger signs which are mentioned in the slide. The exclusion criteria included known history of chronic diseases, regular vitamin or mineral use, and allergies to vitamin or mineral supplements. Study participants were randomized by the GraphPad software on a 1:1 ratio into two groups. The intervention group received 15 milligrams of elemental zinc in the form of a powder sachet dissolved in water twice daily for up to 7 days. The control group received a similar ORS-based placebo. Investigators, parents, and children were blinded during the procedure. Serum zinc level was assessed using absorption spectrometry at baseline and at discharge. Temperature, oxygen saturation, and respiratory rate were assessed using the glass thermometer and the pulse oximeter by the nurse 4-hourly during the admission duration. Chest auscultation, chest indrawing, and danger signs were assessed by the physician twice daily during the admission duration. Institutional ethical approval was also attained. The primary outcome was time to cessation of ALRI, and the secondary outcomes included duration of hospital stay and clinical parameters. The statistical tests were conducted on SPSS version 23. Kaplan-Meier survival analysis was the primary analysis. Continuous variables were compared between the two groups using student t-test, Mann-Whitney U-test, and descriptive statistics. Time to cessation of ALRI was 2 to 4 days in the intervention group and 3 to 5 days in the placebo group. ALRI cessation was significantly faster in the intervention group with a p-value of 0.008. Hospital stay was an average of 3.8 days in the intervention group and 6.1 days in the placebo group. Hospital stay was significantly shorter in the intervention group with a p-value less than 0.001. The secondary analysis of clinical parameters was not statistically significant.
The study explores the effects of adjuvant zinc supplementation on Thai children with acute lower respiratory tract infections, ALRIs. The study discovered that zinc supplementation, that is 15 milligrams elemental zinc twice daily, shortens the recovery times and duration of hospital stay in Thai children with ALRIs. This is similar to previous studies in Indian and Bangladeshi children. However, studies conducted in indigenous Australian children and Indian children showed no clinical benefits. There is a high prevalence of zinc deficiency in developing countries. This can be attributed to the malabsorption of zinc and inadequate intake of zinc-rich foods. The study used approximately 2 to 3 times the recommended daily allowance for the treatment of zinc deficiency. This was correlated to a shorter recovery time. One-third, that is 34.4% of the hospitalized Thai children with ALRIs had zinc deficiency. Organic zinc has higher bioavailability than inorganic zinc. This study used zinc bisglycinate, which has a higher bioavailability amongst the organic zinc compounds. Zinc deficiencies can impact the healing process in acute lower respiratory tract infections. Zinc bisglycinate has higher bioavailability than other organic forms of zinc. This assignment deepened our understanding of the physiological roles of zinc and its specific benefit in pediatric infections. It allowed us to consolidate our understanding of randomized controlled trials and extract vital information about the methods, results, and discussion to form a logical conclusion.